Could vitamin D deficiency increase the risk of heart disease? Vitamin D, also known as the sunshine vitamin, is a fat-soluble vitamin that exists in two main forms, D2 and D3, as an essential micronutrient and one that is primarily derived from sunlight. Vitamin D is important for the development of bones and teeth and the regular functioning of the immune system. Beyond these functions, previous studies suggest an association between low vitamin D levels and a higher likelihood of developing cardiovascular disease. In a new study, researchers have established that it is worthwhile to check vitamin D levels when assessing a person's cardiovascular risk. Worldwide, cardiovascular diseases are one of the leading causes of death. Every year, an estimated 17.9 million people around the world die as a result of complications from heart diseases. For context, this means that cardiovascular diseases are responsible for 32% of all deaths globally. Prior studies show that various factors such as several health conditions, age, family history, diet, and lifestyle combine to influence the risk of developing cardiovascular diseases. Using a novel analytical approach, researchers in Australia have discovered an additional factor that may increase a person's likelihood of cardiovascular disease. Lead author Professor Elina Hyponen, director of the Australian Centre for Precision Health at the University of South Australia Cancer Research Institute, outlined the results of the study. We found evidence that vitamin D deficiency can increase blood pressure and the risk of cardiovascular disease. However, she added, increasing vitamin D concentrations will only be helpful for those participants who need it, and further benefits from elevating concentrations beyond the nutritional requirement are going to be modest, if they exist. The results from the study appear in the European Heart Journal. What do the experts think? Dr. Rigved Tadwalkar, a board-certified cardiologist at Providence St. John's Health Center in Santa Monica, noted that the study has clinical implications. He observed that there has long been confusion as to whether to check vitamin D levels when assessing cardiovascular risk and what to do with the information after obtaining the results. However, now, this study establishes that it is worthwhile to check vitamin D levels for the purpose of assessing cardiovascular risk and, moreover, supplementing vitamin D for those who are most deficient. Strengths and limitations. The authors explain that the strength of their study lies in the novel way that they analyzed their data. To their knowledge, the study is the first genetic analysis using a nonlinear framework to explore the shape of the association of 25-OHD with cardiovascular disease risk. Furthermore, through rigorous experimental practices, they are able to minimize biases and reduce chance findings. Despite their strengths, the study is not without its limitations. First, by limiting the analysis to participants of white British descent, it is not clear whether the study results are applicable across other ethnic groups. Also, with a response rate of 5%, UK Biobank is not representative of the general UK population, despite its large sample size. Nevertheless, the results of the study may lead to new possibilities in the management and diagnosis of cardiovascular disease. Dr. Ted Walker's final comments on the study share a similar optimism. People should discuss checking their vitamin D level with their physicians, as there is variability from one doctor to another as to whether this is checked as a matter of routine. If the vitamin D level is found to be significantly low, there is now evidence to suggest that increasing this level will decrease cardiovascular disease risk, including the risk of coronary artery disease and stroke.